Our goal is to promote microbiological sciences in the form of education, laboratory understanding, and research as it pertains to all of the microbiological sciences. And so we have 26 different divisions covering all the specialties in microbiology, as well as one devoted to microbiology education.
Two years ago, ASM signed a cooperative agreement with the Centers for Disease Control and Prevention to collaborate on the President's Emergency Fund for AIDS Relief, more known as PEPFAR. ASM's clinical microbiology experts understand the integration and expansion of services of laboratories at all levels. ASM is currently working in several countries in Africa.
Well, we're using the expertise of our membership to bring scientists to laboratories in these countries to work on better diagnostic technologies, quality control, quality assurance, working with locals to try and make certain that the programs that are developed are sustainable so that we can use diagnosis as a way to increase prevention and treatment of disease.
Livingstone in southern Zambia is a major tourist attraction for travellers visiting the world-famous Victoria Falls. But in this area of incredible natural beauty, the local population suffers a 20% HIV infection rate, 4% higher than the Zambian national average. Among pregnant women attending local clinics, HIV prevalence reaches as much as 30%.
The American Society for Microbiology has brought a tremendous amount of support here to our work with the Ministry of Health. They have been very instrumental in assisting us with scaling up HIV/AIDS support for opportunistic infections such as tuberculosis and other infections. And particularly we've had significant concern about TB in people that are living with HIV/AIDS because it's very difficult to diagnose with conventional light microscopy. So ASM has been instrumental in assisting us with training people on site in order to do fluorochrome smear microscopy, which is a method that is much more sensitive in detecting tuberculosis in HIV/AIDS patients. Prior to our work with ASM, we were unable to have a lot of quality control. So now we have commercial blood culture bottles and a rapid BACTEC 9050 blood culture detection system. And the ASM staff has assisted the Ministry of Health laboratories and technologists in several parts of the country. And it's been excellent in bringing up the quality of the laboratory work.
The building that we're standing in is the new Pediatric Center of Excellency, which is fully sponsored and funded by the PEPFAR. A number of laboratory partners, including ASM, will assist us in expanding the laboratory care, treatment care, patients. Dry blood specimens will be collected as dry blood phosphate, will be sent to UTH pediatrics wing that will be carrying out PCR on infant diagnosis of HIV. So using DNA technology, which employ PCR, we'll be able to capture the antigen for the HIV from the infants. And as such, it will enhance or give a guide to the doctors to initiate treatment.
ASM is playing a key role in this partnership with the CDC, the Ministry of Health, and the other US agencies. Plans for the future include the addition of the Ministry of Education. We are looking forward to this new player because it will ensure the sustainability of all the programs and efforts from all these partners. In this respect, Zambia is becoming a model for the whole African region.
The resources are there. There are talented, bright people, any nation you want to go to in the world, who can be taught the right techniques to do the job properly. I think we're doing wonderfully well. The projects that we've initiated have gotten excellent feedback, both from the people in place on the ground, from the CDC to us, and the best sign is the interest that is being shown by other countries in using our services now that people are aware of what we can do.